Now, I'm going to take it away. I'm going to tell you a little bit about her. So, Blythe is a lifelong Hoosier. She works as a small business owner right now, but she has always served her community even before that. She is a U.S. Army veteran. She completed her back in Iraq, and she even served on the front lines as a personal detail for General George Casey, a driver, a gunner, the commanding general of a multinational force. So let's just say, Blythe is a very powerful woman beyond even the words that she is going to get up here and share with us today. You might look at her and see like what a lovely person she appears to be, but watch out, man, she can definitely take you down. I'm scared. Okay. Come up here.
All right. Thank you all for being here. Thank you for anyone choosing to engage in politics, especially so early on in the election next year. Being here is just, it's such a service to our state. So thank you. I'm proud of taking the Democratic Party nomination for Secretary of State in 2026. And it's time for making sure your state today for Batesville. June 6th is we have a convention for the state. Candidates for you to vote for me should you become a delegate, and maybe everyone about that as well. So today's topic is healthcare. Secretary of State doesn't oversee healthcare, but the way we get us out of the mess that we're currently in now is by voting. In Indiana's 50 out of 51 for voter turnout, and it seems like it can only go up because getting worse will be detrimental for everybody. By doing that, I want to we have every registered voter in the mail telling them about every single candidate so we can make better decisions on who we're voting on, what kind of policies they may be making. So when you see your congressional candidate from here, imagine being able to have some notes and information delivered to your door before you go to vote for them, which is something we don't have that other states do. Currently, the average household, this includes homes with no children, spends about $6,000 a year on healthcare, which I think that's a low number for me. $1,400 on childcare and $1,700 a year on education. If we were to tax the rich, that would go from sitting at about $9,100 a year to $2,000 total for healthcare, and that would benefit everybody, not just large corporations, not just billionaires, not people who are in the poverty level, but normal everyday Hoosiers like us. So voting on people up and down the ballot next May and next fall who are going to care about human rights, which includes healthcare. It is so important. Human rights can no longer be negotiable. It does not matter what side of the aisle these candidates are sitting on. If they do not put human rights above all else, to include healthcare, education, safe housing, safe air, safe water, we won't have a stable country to live in. So thank you for being here. Ensure you are registered to vote. Check your voter registration regularly, especially women. The state act is still on the table. It is still in the Senate. It may or may not be passed by the time we go to vote next year. So make sure we're paying attention to that. Continue to share information. We're still seeing that mainstream media is not covering progressive and grassroots candidates like myself, like Victoria, like Hunter, like your candidate. We have a debate today. Make sure to represent the biggest thing you can do for your neighbors, your friends, and family to share information and make sure that they're getting on the votes. Thank you for being here. Thank you for having me.
Yeah, that's fine. Second. Oh, so obviously all here today to talk about healthcare related matters. And so our second keynote speaker is a doctor. Today we're looking at Dr. Stuart Ray. He is a professor and specialist in infectious diseases from Johns Hopkins School of Medicine. He focuses on virology like HIV and hepatitis C type diseases. He's going to be here to talk about what funding when science research gets cut. Please join me in extending a tremendous welcome to Dr. Stuart Campbell.
Thank you. It's great to be here to talk about this topic to people who understand how important it is. I think we were reminded by Christina some comments about her recent journey, and I hope that goes well for her. Always important about these things. And the reason I'm here today is because I've got family here being away, and so they are here part of Batesville, and we're here to celebrate her birthday and and also to remember the healthcare report that this process is how we get funded. We know that our system is broken. It's broken in many ways, and the middle layer of healthcare management is sucking off the funds that should be going to healthcare. We don't know the benefits manager company research now. And of course, if you've ever health insurance, you know about approvals and denials and 65 simple advantage. And doctors like me spend a lot of time dealing with those people that are ridiculous. So we struggle with it. So I'm actually a professor of medicine, so I'm in I think everything I spent most of my career taking care of the because we are affected by drug use disorders and patients that including HIV. When I started at Johns Hopkins 35 years ago, I had a patient I cared for at HIV, and basically all people were dead. 10 years. President was affected by the we had medicine that was effective. And today, we mostly with HIV, 1 pill a day is all they need to live a long, healthy life. That's an amazing thing. Now, we've learned about that I saw that someone in the baseball said is 1921. That's what we got where we were in 1921. 1921 was the heels of the pandemic of 1918. Now you may know that it is true, you may not know that. And the U.S. government was press, so there wasn't American flu, Spanish flu, war, and not the press. Disease, nobody understood. That's why so that's the problem. We need to be clear about healthcare because it has to be now, what do we know that? Well, we didn't know what was going to be a virus. We didn't know what was causing the pandemic. So we today have a bacteria called Hopkins named people died with that bacteria. We didn't talk disease. We learned about pneumonia. That's the pneumonia vaccine people get. That's the end of the pandemic. It was not the cause of the pandemic. It was another 15 years before people learned that DNA wasn't all this. And it was another 10 years after that before we even did the function of DNA. So we discovered DNA was, RNA was, because of that pandemic. So the way that America responds to crisis is by researching and figuring out scientifically what causes this and how do we mitigate. Today, we have flu vaccines. And I get mine every year because I know that my patients who get the flu vaccine are far less likely to die from flu that year. And now I'm getting old. So I make sure I read that. And as controversial as the COVID pandemic was, it's very clear that those COVID vaccines stay really clear on that. I'm happy to talk about that if you want to talk about it. But those vaccines saved millions of lives. It took decades to develop the technology that made it possible for that vaccine to get developed. and it got developed fast. And it got developed through the support of President Trump. He's got lots of mailings, but he did back that vaccine early on, and private industry helped accelerate that program. So our government has a big role in making sure these things happen. And so we need to fund these initiatives, and where does that? Where does that money go? Biomedical research funding goes to American people doing the work. So it's funding jobs. The people are learning, so it's their training. They're training young people to do the same. So people are brought up, excited about what they're doing because of that biomedical research funding. Where do we get our supplies? Most of our supplies are sourced in the United States. So that's jobs for the people who develop the DNA isolation columns and the apparatus that we use to measure things in the research labs. All those things are American dollars creating American jobs. And that grows the economy because the companies that spin out, when we make discoveries and they turn into products, that's growing the economy. And we all know that there's two ways to make fight over dollars and share, we can increase the value of the U.S. government's economy. And so growing the economy is one of the ways that we grow the quality of life for everyone. Biomedical research not only improves our health, it lets our kids grow up. I know my kids got their vaccines. I hope their kids get their vaccines because we know every one of the childhood vaccines that's recommended saves lives. Every one of those diseases. Whooping cough. When's the last time you saw a kid whooping cough? You don't. When's the last time you saw diphtheria? When's the last time you saw tetanus? I've seen it too. Believe me, you don't want to see it. We have a lot of diseases that are some of them are coming back. Measles is awful. And we've seen outbreaks of measles because of doubts about these vaccines. That does not make sense. If there's information to provide, we need to do a better job. And certainly communication is something that can always improve. We need to hear about what we need to do. But biomedical research company is a stimulant. We'll get back. Hard to compete with you. I'm a professor, so I almost compete with that. Yes. One of the things we need is help be more equitable. We can put it in your hand. And we may not know this in the pandemic, we started having to rapid testing because we're in COVID thing. I think moving forward, we're going to do more and more testing at home, more care at home. I recently had a which I could get at home because of some of the technologies that have advanced. So there are a lot of advances that are parents at home, which reduces the overall cost and helps us engage. And so I think it's very important to think about the world we live in, where you can actually get your own strong, where you can do your own full cancer screening at home, where you can do your own fill in the blank. There's a lot of things we need to do until we understand causing some of these problems. How do we figure out what causes cancer? We need to find the notion that we make sure people don't cause cancer is kind of deep state. It's just ridiculous. Disrespect because we live our lives trying to things, and the notion that we would try to hide what we know about this, and honestly, if you 100 people information try to help them keep the secret, there's no way to do this. So there's no secret about cancer. It's we just need to figure it out, and as the Martians designs the hell out of this. So we need to figure out this, and that comes from biomedical research support. So I appreciate having the chance to talk to you all. I think that remembering where we were years ago, where we are now, where we'll be years from now, we keep on investing in this. It's like a boot shop. And I think we have all seen, I think you all know somebody whose life has been ended miraculously. I'll choose one example, Jimmy Carter, who had brain
Yes.
and that's
Free bags. And I'll try to think all kinds of useful
I don't know if it's and I hope that the candidates who are going to be here are support advancing this region. Our economy is a change to our people and improving the health of our people so they can have policy as a thank you.
Thank you so much again to Dr. Stuart Campbell.
My mom's watching me.
Talking to our everyday citizens about all these questions and running through trustworthy officers. And part of that, I will mention who have the Franklin County Health Department today. Can we get a hand of applause for Franklin County Health Department? They just they got all these staff in their office for the past 2 years. I was out there a couple weeks ago to meet with Ms. Shore and her coworker and some incredible ladies who are talking to the different instances of Franklin County beyond hospital they can come in with just to make sure they have access to information. And if we want to check out our people before we leave today, they have a ton of useful free people in healthcare, connection marketing. So please be sure to check out the people before you leave today. Now, it is time for the event. Are you guys ready to pick your candidate? Okay, so let's welcome to this stage here. I'm going to start this side. Mr. Blythe, our independent candidate for the Congressional District. Next up, we have Dr. James, one of our candidates. Next up, we have Grant Meyer. Welcome to the stage, Mr. James Logan Davidson, the candidate for the 9th Congressional District. And unfortunately, we don't have Mr. Grant here today, but he was very regretful that he could not. He had previous enemies. Okay, so we have an amazing journalist here today, and wait, what? Oh, that's a great question. Does anyone have any way that they feel about our current representative not being here? Yeah, I kind of feel the same. She was invited. She got the same level of notice as everybody, as I said earlier, and she did not dignify us with even a response acknowledging receipt of our invitation. So, thanks, Representative Hopkins. I feel really represented. No, I don't. Like I said, she represents the owners of the means of production class. Like she's not here to talk to her people. She knows her health insurance is covered. She's not even working right now. She's literally on a break because the government is shut down. She's still getting her full salary. She's still getting health insurance coverage. And she couldn't even take a virus in the presence here today to talk to us about what she feels about our health care insurance. Yeah, I'm with you. We gotta spread that message. We gotta spread the message and bind us all together. Because when we are a bundle of things, we can't be broken. So make sure you carry that through with you. But I want to go over there thinking about this. Let's do our amazing announcement we have here today. We have an incredible independent journalist here today who is going to be the leader of our debate. Her name is Rachel Chatham. She's sitting over here at the podium. Miss Chatham, will you stand up and wave hello? We get a round of applause for Miss Chatham. If you want to follow her work on social media, you can find her on all social media platforms under Chatting with Chatham or Facebook right now, right?
Well, I have YouTube.
Okay, Facebook and YouTube under Chatting with Chatham. And again, just a reminder, this debate is being live streamed. If you want to share it on social media later with your fellow 19 Correctional District people who live there, please feel free to do so. I'm going to hand things over to Ms. Campbell now.
Good afternoon, everyone. I'm your moderator, Rachel Chatham, and on behalf of the Franklin and Ripley County Democratic Parties, crucial debate focused entirely on the future of healthcare in our district and state. We have a distinguished panel of four candidates running for the Indiana Congressional District 9 seat, all of whom recognize that healthcare is one of the most significant and personal issues facing our community. Today, we delve into the specific healthcare challenges our constituents face, from statewide policy to the crucial needs of our local communities and the financial burdens on small businesses. Before we begin, let's review the rules that will govern tonight's discussion. Candidates will have up to 2 minutes to answer each question. Candidates will have up to 2 minutes to answer each question. I will raise a yellow card to indicate when 30 seconds remain, and a red card when the 2 minutes are complete, at which point the candidate must conclude their statement. A candidate may request a 30-second rebuttal only if their name is directly mentioned by the opponent. To request a rebuttal, please raise your hand immediately. Once recognized by the moderator, you will have 30 seconds to complete your rebuttal. To ensure structured and timely discussion, 3 rebuttals will not be permitted. Candidates are permitted to refer to notes during the debate. We will begin with a 2-minute opening statement from each candidate. This is our opportunity to introduce yourself, briefly share your campaign's vision, and outline your general approach to healthcare. We will proceed in alphabetical order by last name, starting with Mr. James Logan Davidson. James Logan Davidson.
Hello, folks. My name is James Logan Davidson, and I am proud to be running as a Democrat for the 9th District. Listen, we're going to hear a lot about statistics today from all of our candidates up here, including myself, but I just want to be completely honest with you. I not only have been a statistic, I continue to be a statistic. For the first 25 years of my life, I was uninsured. And my health care was a hospital. Okay, it was the emergency room. And me and my wife are 2 proud teachers. And we still struggle to pay to afford our health insurance in the richest country on earth. And listen, you know, in an ideal society, we would have already fixed this horrible problem to have. We would have universal health care. I'm a proud supporter of universal health care, but we don't live in an ideal world. Because of dark money in politics and congressional gridlock, unfortunately, that is not on the table at this time. But what I do support is a public option. It's long past time that the working poor and the working class had an option, an affordable option for healthcare. And, you know, we may hear some things today about how can we afford that. I want to be unequivocal at the beginning. We're already paying for it. We have the highest cost of any nation in the world. We spend $5 trillion a year on our healthcare. We're already paying for it. So I have the pleasure today to be here and discuss to you how we're going to get there.
Thank you. Thank you. And now Brad Meyer.
Hello, I'm Brad Meyer, and I'm running for the U.S. House of Representatives in the 9th District. Thank you. So, I've been a strong supporter of universal health care for many years. Since I started running, I've had 2 health care forums, one in Bloomington and one in New Albany, discussing as a panel what the problems are. And I'm not a doctor, but I am a member of Physicians for the National Health Program. I don't know if anybody else is a member of that, but I feel very strongly about this because we on average die 4 years earlier than people in similar countries. We have the highest infant mortality. We have the highest maternal mortality. We are the only country in the world, in the developed world at least, which you can go bankrupt just trying to stay alive. The fact is that of the people that are carrying medical debt, which there's a significant number, and in fact in Indiana, we are ranked 11th in the percentage of people that carry medical debt. Those people, 80% of them have insurance. So it's not just a matter of poor people carrying medical debt, it's people that are covered by the existing system. This existing system has been proven that a for-profit system and a nonprofit system are incompatible. Because when we have tried to have a nonprofit government-run system like Medicare and Medicaid, and when we tried to make improvements like the Affordable Care Act, the politicians undercut and undermine what we were trying to accomplish. And in fact, it's happening right now. We're all going to see it. The government shut down because we're trying to fight against it. I believe that we are going to have much stronger legislation. And frankly, we talk about it's a right. It's actually constitutionally not a right in the United States, and that's why I have put forward a proposal to have a constitutional amendment added, because it has to be a true constitutional right if we're going to overcome these problems. Thank you.
Thank you, Mr. Meyer. Now we will have Tim Peck.
I'm Dr. Tim Peck. I'm an emergency physician, and I live in a healthcare desert. I live on a 40-acre farm in Clark County, and the nearest hospital used to be in Charlestown, and it closed down about 10 years ago. And when I say goodbye and kiss my wife and my child, when I go to work at night at the nearest open emergency department 40 minutes away, I know when they call 911 that there's about 90 minutes between that call and CPD in that emergency department. I became a doctor to help people. When I treat someone, I don't ask what party they're from. I don't ask how much money they're making. I don't ask what country they're from. I just help people. The world is burning. Unions are being broken. We can't afford our groceries, and Congress is literally doing nothing. As an emergency room physician, I've said a lot of broken bones, but you know what I've never said is a Democratic broken bone or a Republican broken bone. I've never pulled a partisan bullet at a child. I've never held a hand of independent elderly patient as they were scared they wouldn't make it through the night. I have only treated mothers, daughters, brothers, fathers, neighbors. Every person deserves health care. Health care is a human right. I've been a patient, I've been a provider, I've been a caretaker, and I've helped telemedicine bills in Congress that have saved the lives of millions of Americans. I helped pass those. And if you elect me to Congress, I will deliver health care for all. Thank you for being here, and thank you, Rachel.
Thank you, Dr. Peck. And now, Mr. Floyd Taylor.
I'm Floyd Taylor, and I'm not going to give you party slogans. I'm here because the bills comes through the ER, the pharmacy counter on Main Street, and families are getting crushed. That's why I've written real legislation to fix the cost at the source. The Rural Mobile Health Access Act builds mobile clinics in towns that lost their hospitals, funded with existing dollars, capped at 5% overhead. Preventative care beats midnight ER visits every time, and it saves billions. My Medicare bill makes the program what it should be all along. Dental, vision, hearing, prescriptions, all covered in full. No deductibles, no double billing. My Medicaid bill cleans up waste with real-time eligibility checks, transparent drug pricing, and telehealth parity so rural families don't have to drive 2 hours for care. And the Main Street Health Compact guarantees every American baseline affordable coverage, forces insurers to compete under transparent benchmarks, and funds itself responsibly. No more hiding behind subsidies or secret contracts. And here's the difference. I'm not asking you to take my word for it. You can read every bill, the full text, the plain language explainers, the fiscal impact statements, and then support or oppose them yourself right now in the Congress app. That's radical transparency, and that's how we put the power back in your hands. Thank you.
All right, thank you, gentlemen. We will be in our first round of questions. All right, do you advocate for federal policy that aims to aggressively expand the Medicaid model to more citizens, possibly through a national buy-in, thereby retaining the role for private insurance? Yes, and let's start with Mr. Meyer this time. Let's start with Mr. Meyer this time.
So, yes, unequivocally, yes, we need a national healthcare system that is run by the government. There are, I'm a paper person, so I did some research on all of the different government-run healthcare systems, and we have Medicare, we have Medicaid, we have CHIP, we have the Indian program, we have one for active duty, we have one for veterans, we have a lot of experience. Half of the people in the United States are already covered by a government-run system. And what we have seen is that 70% of people are in favor of a national health care program, and it seems like 0% of the politicians are in favor of it. And the reason is because the insurance companies will spend as much as they have to buy off politicians to keep anything that could work better and save money out of our hands. And they've undermined the Affordable Care Act and everything else that they can do to undermine this. They have shown themselves to be incompatible with a system that gives us a longer life and better health care.
Thank you, Mr. Meyer. Next, I have Floyd Taylor's question. Would you like to repeat it? Okay. Do you advocate for a federal policy that aims to aggressively expand the Medicaid model to more citizens, possibly through a national buy-in, and thereby retaining the role of private insurance?
I support the idea of expanded Medicaid for Medicare, but those programs are bloated now and are inefficient and they need to be fixed. I've got a Main Street Health Compact that guarantees everybody gets affordable coverage, whether they need Medicare, Medicaid or not. So technically, I support the idea, but I don't support expanding Medicaid itself.
Thank you, Mr. Taylor. All right, now may we have Dr. Peck?
Healthcare is a human right. Everybody deserves healthcare. And if you don't have coverage, my plan will get it for you. If you like your union plan, you get to keep it. And under this plan, no one goes bankrupt for going sick. We'll level the playing field so small businesses get the same deals with insurance companies as giant corporations. We're building a bold and ambitious system where everyone has the same power. Everyone has the same power to choose the plan that works for them. It's healthcare your way, not Washington's way. My plan starts with the simple truth. You can't fix healthcare by pouring more money into a system that's already designed to waste it. Right now, half of every healthcare dollar goes to executives, middlemen, TV ads, corporations, and shareholders, not to patients and providers. My plan takes those costs out of the system so that every tax dollar goes where it should, which is straight to patient care. That means reopening rural hospitals, paying nurses fairly, and letting healthcare decisions be made by patients, not a commercial on TV or an insurance company's algorithm. We will deliver healthcare for all.
Thank you, Dr. Peck. And Mr. Davidson, would you like the question repeated?
No, as I said at the beginning of my introduction, I support a public option. And obviously, I don't think that anyone should go bankrupt for their inability to afford health care. Now, I also support a Medicaid expansion because, let's face it, it is costing more and more money to be an American. I think our poverty rate is probably higher if we expand where it actually should be. Not only that, but some of our candidates here have talked about we have to lower costs. Some of the detriment that we get into when we start to have a conversation on how we transition, as I said at the beginning, was how are we going to pay for it? We're already paying for it, but the government is the only entity that's big and strong enough to actually come in and lower our healthcare costs. And not only that, but I think it's anti-business. It's anti-business to expect corporations to pay our high healthcare premiums. You know, our current president wants to bring manufacturing back to the United States. I'm in Ripley County. I'm from Washington County, where Aaron Houchin's from. I share some of those concerns. We have to bring opportunity back to the United States, right? Some of the detriment to that is the cost of healthcare. Let's bring it down. Not only that, I used to work with entrepreneurs. I was big in helping entrepreneurs start their business. And one of the biggest detriments to someone going out on their own and beginning their own business is not only the cost of healthcare for themselves. So I'm going to quit a job with good healthcare and go out on my own and try to get insurance through a private market. But how do I retain talent? How do I keep somebody from going to Humana? This would be the most American, the biggest move towards opportunity economy that we've ever made. And we cannot let Republicans own the conversation on it. This is the most American pro-business thing that we could possibly ever do. It's not just about the customer or the patient. Thank you.
Thank you, Mr. Davidson. Our next question kind of ties into the last one. What policies would you propose to handle insurance monopolies? Let's start with Mr. Taylor. Did you hear that okay? I can repeat it.
I've written the Main Street Health Compact that gives everyone baseline care. And it goes the opposite way of the ACA, where the government doesn't pay insurance companies to treat you, it pays the provider. The insurance companies can get in line and try to compete for your business, but they'll have to compete because everything will be public, everything will be on the dashboard, you'll be able to see exactly what you're getting. And in most cases, they will be out of luck because you'll have a public option. That's what I think about insurance.
Thank you, Mr. Taylor. All right, can we switch to Mr. Meyer?
Thank you. So in my plan, private insurance is not part of it. Private insurers spend 12 to 18% of the dollars that they bring in on administration. The cost for Medicare, Medicaid, for governments to do administration is 1.3%, 10 times lower. And people talk about, well, we don't need a government bloated system. We don't need Washington involved. Yes, we do, because they do a dramatically better job and they care for about half of the people without the enormous cost. Most retired people are covered by this. And in fact, you try to bring them into the system and you try to engage them. And Medicaid Part C has hundreds of billions of dollars of waste in it that we could have saved if people had been in Medicare A and Medicare B. It's not a system that works. We tried to play nice with the insurance companies and bring them in and use market forces for the Affordable Care Act. And in response to that, the Republicans forced us Democrats to bring it in and bring it in the public response. And then after we changed from what we really wanted and really needed, they didn't vote for it anyway. So there's no reason to compromise with people that are going to walk away at the last minute. And then they spent the next 15 years saying, hey, we've got a better plan, but they didn't have a better plan. They have tried 100 times to undermine the Affordable Care Act in Congress, 60 times in the Senate, and all of that undermining is the result of billions of dollars being owed to congressmen by insurance companies and healthcare providers. They are the corrupting force. We spend 18% of our total GDP on healthcare. European countries spend 9%. We spend twice as much or worse care. And it's because we have allowed the for-profit motive to stay in. They are not better at administrating. It is not a bloated system. The bloated system is the one that costs dramatically more, and that is the one that's for-profit. And the profit is being made off of our death and suffering.
Thank you, Mr. Meyer. All right, Mr. Davidson, would you like the question repeated?
So as I mentioned, first and foremost, if we're having a conversation on this, we have to talk about dark money. So the first thing that I can do, that I can control, is say no to no corporate super PAC money. That's what we have to do. We have to get dark money out of politics. Secondly, I do want to make a caveat here. We have a legacy system. We have a bloated insurance system. And although I do think that some execs are making too much money, we have to be careful as a government. This is not a regime change here. We cannot forget the millions of Americans that have just regular jobs for these insurance companies. What are we going to do about this? So we also have to consider that as well, because we don't want to put people out of jobs. You know, right now the government is making it their mission to make people jobless. That should not be the the role of government. Secondly, we really have to focus on messaging. Messaging is the most important factor of any conversation that we have when it comes to insurance companies, because if we can't get the dark money out of it, they have a better message. We have to sit down and realize that for patients, this would be a better option. For even corporations and businesses, for entrepreneurs, for children, all of this is better option. The only entity that is harmed in this situation is the private healthcare insurance companies. Okay, so are we willing to allow our country to go bankrupt for people to not be able to afford healthcare bills for the profits of some health insurance companies? That has to be it. 99% of America would be made better off if we fix this problem. And as I've said, it's an ignorant problem for a civilized society to have.
Thank you, Mr. Davidson. The next question has to do with the ongoing government shutdown. The current government shutdown has stalled action in Washington with Dr. Peck.
Thank you. I want to make the plan very clear on how we get monopolies to dissolve, to not be strong. These insurance companies, of which I've been fighting for many years, both as a clinician and as someone who's owned physician groups and operated them, having to fight the insurance companies for every single dollar for the patient. Money from taxpayer money should not go into the pockets of executives. They should not go into billion-dollar ad campaigns that go into your living room. They should not go to prior authorization that gets in between me and you when we're trying to get you the right test. So when a federal tax dollar goes to pay for healthcare, it needs to go directly to the patient-provider interaction. If it doesn't, if that insurance company uses it for their shareholders, uses it for their executives, uses it improperly, we will claw that money back from them and fine them for doing it so they never do it again. I believe in a public option to compete with the insurance companies. However, I want to make something clear. I heard a number up here that Medicare has 1.3% overhead. Medicare does not do most of the work of paying for healthcare. They have to work with the private insurance companies currently to administer the bill, to work with the pharmacies. They have to work with corporations. If we don't tamp down the corporations, Medicare will continue to be subservient to insurance companies. Thank you.
Thank you, Dr. Peck. Sorry about that. The current government shutdown has stalled action in Washington with millions of Americans facing uncertainty. At the core of the impasse are the negotiations over healthcare spending, specifically the Enhanced Affordable Health Care Act subsidies set to expire at the end of the year. Should Democrats vote to immediately open the government with a clean bill and interfere the fight over the expiring ACA subsidies, continue the shutdown and refuse to vote for any funding unless it includes a permanent extension of the current ACA subsidies, or use the leverage of the shutdown to demand an even greater expansion of government-backed healthcare, such a vote on Medicare for all or request public opinion. Please state what strategy you would support and justify your choice by weighing the political risks, the immediate cost to the American public, and your ultimate vision for healthcare. Let's start with Davidson.
So this is a very poignant question right now, and it's not an easy answer. Of course, in a scenario like this, you want to think that we can use the little bit of leverage that we have and fix the problem, which this problem's big. I mean, I said at the beginning, every single American, including people this audience and people watching at home, your insurance premiums are going to go up no matter if you qualify for ACA subsidies or not. And as I said, this is the only leverage that Democrats have right now. What I will say is that we have to weigh our leverage with the ramifications of that leverage. There will be people that in December, especially with our current administration, that may not have food on the table. So, although I do agree with it, and I think that we should fight for the ACA expansion, I am nervous about the economic outcomes. So we do have to weigh that. It's time sensitive, but right now we have to use that leverage because people just won't be able to afford healthcare. And I heard a statistic the other day that 50,000 people will die. So that's part of the calculus too. I agree with what Democrats are doing, but we also, it's just a hard situation. I don't know how to give you an answer that is the correct political answer, but right now this is a horrible situation that we find ourselves in. And to be honest with you, one of the things that Congress has to stop doing is stop playing the blame game, and we have to get to work and find solutions for Americans.
Thank you, Mr. Davidson. And Mr. Taylor, do you have a question repeated? Okay. The government shutdown has stalled action in Washington with millions of Americans facing uncertainty. At the core of the impasse are the negotiations over healthcare spending, specifically the Enhanced Affordable Healthcare Act subsidy set to expire at the end of the year. Should Democrats vote to engage in the open government bill to further fight over the expiring subsidies, continue to shut down and refuse to vote for any funding bill unless it includes a permanent extension of the ACA subsidies, or use the leverage of the shutdown to demand an even greater expansion of government back to healthcare, such as a vote on Medicare for all or a robust public option. Please state which strategy you would support and justify your choice by weighing the political risk, the immediate cost to the American public, and your ultimate vision for healthcare.
No. I've read the CR, and it's anything between. I think that they should stand firm. I think that they have no choice. Anything else that's going to hurt people. I mean, people are going to be hurt anyway. But without it, my medical insurance bill just doubled this year, and that's a lot of money. I can't afford it. I don't think anybody can afford it. My insurance bill is probably more than most people make. So I think they should fight it out. I mean, there's going to be pain no matter how you do it. So stand firm. Thank you.
Thank you, Mr. Taylor. Dr. Peck, would you like to watch the meeting?
I'll never compromise democratic ideals. Right now, democratic ideals are suffering with what's happening in DC. 42 million people are losing their SNAP benefits and not being able to feed themselves. There are tens of millions of people who will lose their coverage from the ACA, from Obamacare, if we don't find a way forward in Congress. Democrats need to stand firm on those things, but we need to move forward so that people can get SNAP, so that people can get health care. So what I'm proposing is to work with Republicans and put forward a bill that allows for us to continue the government as it was before the shutdown for 6 months. And have it so that we can actually work together to make sure at the end of the day, everybody keeps their SNAP, everybody keeps their health care. In fact, we can fight for health care expansion as Medicaid and Medicare have been cut by the Republicans. That's the plan. We need to feed people, and we need to get back to work in DC. Thank you.
Thank you, Dr. Peck. And now, Mrs. Ryan. The question repeated.
It was very long, but I think I got it. Okay, so the question is, should we cave and reopen the government? And the answer is no. You know, I started, again, a paper person, I started to try to make a list and understand all the effects of the big, beautiful, or bad bill. And the bottom line is they are trying to obscure everything they can, so it makes it hard for people to understand what they can and can't get. They're making it intentionally complex, so that it's harder for you to get benefits once you understand it. And they're making it intentionally denial-based, so that once you understand and once you can try to get it, they're going to say no, then they're going to undercut it. And what they're doing with this is they've got us, again, for the 100th time, on our back foot. Right? So we're not arguing over how can we make it better. We're arguing over whether we can make it suck as much as it did last year. Right? And we need to stop trying to just, they're shaving pieces of our society off on the floor, and then we run around to try to pick up the scraps off the floor. We need to start advocating for what we really need, which is universal health care. And it needs to be nonprofit, government-run health care. So yes, we have to leave the government shut down. And I'll tell you, I worked for the Navy as a civilian employee for 9 years, and I am sick to death of hearing about CRs. The fact is Congress's primary job is to schedule and run a budget. Every year, they get worse and worse about doing this, and they go into a CR, and a CR says, we're not going to negotiate over what we spend next year. We're going to keep in place what was done last year. The entire last year was under a CR, no budget. They've done this several times. In my opinion, and people say, well, if the government shut down, I think Congress should not be paid. No, I think if the government is shut down because they didn't get a budget done, they shouldn't be allowed to stand for election in the next cycle. They need to get out of their job because they're not doing their job.
Thank you, Mr. Ryan.
Is my time expired?
Yes.
Thank you.
All right, please be back to hold your pause until the end of the debate, just to get through these. The next question is, cancer rates are higher in rural areas. Recent reports showing environmental relations. What plans do you have to help with preventative care plans for those currently affected? And we're going to start with Davidson.
I'm so glad that you asked that question, because I was in the fitness industry for about 10 years. So I was what I perceive to be a form of healthcare. And that's something that doesn't get talked about enough. We do not talk about the prevention of disease instead of the treatment of disease. And the reason that we don't do that is because of our for-profit sick care system. It is much less expensive, or it's much more profitable to treat symptoms than it is to cure a disease. Not only that, we do not take into account the environmental impacts of not only workplace stress to environmental stress. I'm in Washington County. We have some of the higher cancer rates in the state, and some of that is environmental. It's also lifestyle related. It's access to healthcare. It's all of these interrelated things. If we're going to have a conversation about healthcare, we have to make it broad. We have to start talking about our found environment. We have to start talking about how we can incentivize healthy behavior. And if our healthcare system is not doing that, then maybe we need a different one. So if you want to lower cost, we have to have this discussion as a society. If we're going to lower cost and then be able to pay for it, we have to have that discussion. And that discussion is not occurring anywhere, especially in the political spectrum, because of the big money I keep referring to. And we have to transition to a healthcare model and not just a sick care for-profit model. So I think some of that, as we transition to that, I haven't heard it from these guys. I would love to hear what they have to say about that. But again, we can't transition to a universal healthcare system or a public option, I think, unless we all change how healthcare is provided.
Thank you, Mr. Davidson. All right, Mr. Meyer, would you like the question repeated?
Sure.
Okay. Cancer rates are higher in rural areas. Recent reports showing environmental relations. What plans do you have to help with preventative care plans for those currently affected?
So I'm going to do something that pains me greatly, and that is I'm going to agree with Dr. Peck. I think it is, because I think telehealth and telemedicine is going to be an important part of solving the issues with the rural poor. It's an important piece of the solution, and I don't disagree with him about that at all. You know, Indiana, has a high percentage of rural residents, and as a result, we are 39th in life expectancy, and again, that's even on top of the 4 years that we die earlier nationally average. So it's more like 6 to 8 years. There are environmental issues, and protecting the environment is something I'm not going to get into in this, but we need a healthcare system that people can get what they need when they need it. I think telehealth is a good option for that. One of the things that we're all worried about right now is rural hospital closures. And there's been a lot of hospitals that's gone out and reduced the amount of services that they are able to provide. And one of the things that some people, I don't think anybody up here is saying, well, you know, a for-profit system will take over and the hospital will remain. Interesting fact, they did a study of what happens when systems are converted to for-profit. And the emergency room death rate in that study went up by 13%, going from nonprofit to profit. So if you want to talk about the for-profit medical system, 13% death increase in the emergency rooms. Thank you.
Thank you, Mr. Meyer. And Dr. Peck, would you like the question repeated?
Chronic conditions are very high in rural areas. That's what we do about it. So, thank you so much for the question. America has over 25 million people who are uninsured. What do you think the uninsured rate for white-collar workers is? About 2%. What is the uninsured rate for people who are farmers, for people who drive trucks, for people who work hard with their hands? 28, 29%. People in rural areas are the ones who suffer from not having a public option and a way to make that public option for them to get health care. We need that option to give them health care, to be able to make sure that we have preventative care, which saves money in the long run. It is expensive to be sick in this country, and that needs to stop. Thank you.
Thank you, Dr. Peck. Mr. Taylor, would you like the question repeated?
This one, it's especially hard for me because a two-time cancer survivor, I do not enjoy having to drive to Louisville every time I need to get care. I mean, it's 45 minutes each way, and it's a real pain in the ass, excuse my French. I propose the Rural Mobile Health Access Act that puts mobile clinics in every community. Maybe not every day, but every couple of days. So you don't have to worry about having to drive to Louisville just to get a checkup. You don't have to worry about going 2 hours just to get weighed and measured. You can go, you can get checked, and it costs you nothing. If you don't afford it, if you can't afford it, no cost. That's my proposed solution to the problem.
Thank you, Mr. Taylor. Sorry, guys. I just wanted to interrupt for just a second as the MC. We were hearing from some people in the back. It's hard to hear what the speakers are saying with side conversations. So if we could hold our discussions till the end, and then also let's hold our applause. Okay, and let's hold our applause until at the end of the debate. Okay, that's all. Thank you. Alright, because of the end of abortion law, some doctors are worried about treating women who have serious pregnancy problems because they fear being sued or arrested. What will you do to make sure doctors can quickly treat a woman who is in a medical emergency without having to check with their lawyers first? And we'll start with Mr. Davidson.
What simple answer to this? What happens in a hospital room or with an OBGYN between a woman and her doctor is none of the government's damn business. I mean, let's be honest there. Secondly, I think that there is more common sense agreement on this issue when you get into these tangible things. I think even we see this in Indiana. We have an abortion ban here, and I think we can have common sense conversations with even Republicans about certain elements of certain situations. So I think that that's something you have to fight for. No woman should have to die because she didn't have a choice. I mean, that's something I stand for, and that's something I'll fight for in Congress. This is a pretty simple answer.
Thank you, Mr. Davidson. Mr. Meyer, would you like the question repeated? Because of Indiana's abortion law, some doctors are worried about treating women who have serious pregnancy problems because they fear being sued or arrested. What will you do to make sure doctors can quickly treat a woman who is in a medical emergency without having to check with their lawyers first?
So I would disagree with one part of the question. I would say not just some doctors, I think many or even most. And I think when Dr. Peck gets the microphone, he'll expound upon that in detail. This should be an issue of medical care between a woman and her doctor, period. But unfortunately, it is a political issue right now. And as long as we are politically weak, we are never going to be able to get politics out of the doctor's room. And that's one of the reasons that I'm running.
Thank you, Mr. Meyer. And Dr. Beth.
I'm an emergency physician. I've treated a lot of women who've been raped. I've treated girls who've been raped. This week, I treated preteens who've been raped. And never once, when giving my counsel in that exam room, did I think about what the government had to say. I still don't think about what the government had to say. I've taken an oath to do right by the patient, and then all else will fall into place. And if I do right by that patient, and it brings me before the Supreme Court, so be it. This issue is going to the Supreme Court because myself or one of my colleagues is going to get into this situation. It is inevitable because women are in pain. Women have their lives threatened every day. This is not something that we've imagined. This is a real problem for women, their families, and their faith. Thank you.
Thank you, Dr. Pat. Mr. Taylor?
I'm just going to have to agree with all my fellow constituents here. It's a medical problem. It should never be a legal problem. If I had to fight for it, I would fight for it. I'll pay for their lawyers. I don't care. That's all I have to say about that.
All right, the next question is related to the last. Additionally, if elected to Congress, would you vote in favor of legislation that codifies the core protections of Roe v. Wade into federal law? establishing a national right to abortion access up to veto viability.
And
We will start with Davidson.
Right. So the first question was a medical question, and now we're into the politics of it. Let's be honest, in the 9th district, this is a hot button issue, unfortunately. And, you know, I think that we have to lead with our conscience and morals and ethics on this issue sometimes. And yes, I would support that. I think that we have to message it correctly. And that's what it comes down to. I think that we're just getting beat on messaging. And, you know, I have some interesting concepts on that, on how we can message it, based on what I feel. You know, my friends and family all would probably disagree with me on this issue, but if I set them down in a room and we have a conversation, they end up agreeing with me. This is a medical issue that you've turned into a political issue, so we have to message it as a medical issue.
Thank you, Mr. Davidson. Mr. Meyer, would you like the question repeated?
I think I got this one. Okay, so yes, I would support a bill in Congress that provides a federal right. Unfortunately, I don't think it's going to be upheld. The reason is when they overturned Roe v. Wade, they were very explicit in saying they're pushing it back to the states. So if the federal government tries to get in and put a law in place that says it is federally accepted, it's going to go back to the exact same court that said it should be a state issue. So yes, I would sign it, we would fight it, but I don't know if it would hold up constitutionally. I believe that what I have proposed, and if you look on my website, bradmeyer.org, in the healthcare section, I actually have a section in there about a constitutional amendment for healthcare. And I believe that abortion should be enumerated explicitly in that, and it would eventually put it to rest. That is a very long-term strategy. Short-term strategies, we're going to have to go state by state. In Indiana, we're going to have to start winning as Democrats, and y'all are going to have to start supporting Democrats and bringing friends and neighbors in and getting Democrats in, and we'll change the state law, because that is probably the thing that will be upheld. They didn't say that it was illegal. They said it was a state issue, and then our state rolled over and took it away from us. So we need to start there. It's a tractable problem, and it's something we can do right bloody now.
Thank you, Mr. Meyer. Dr. Peck?
Day one of Congress, I will support or submit a bill to restore abortion rights to all Americans. Thank you.
Thank you, Dr. Peck. Mr. Floyd or Mr. Taylor?
Of course. Simple answer. Of course I would. There's no reason not to.
Thank you, Mr. Taylor. All right, misinformation has become a major threat to public health, specifically widely debunked claims linking vaccines to autism, often amplified by high-profile figures, directly undermine efforts to achieve community immunity. If elected, how would you leverage your position in Congress to effectively combat and counter dangerous health misinformation? Davidson?
So first off, I am a special education teacher, so this is an issue that's firsthand for me. I've dealt with misinformation with students or children with autism for a long time now, and it's this all comes back to messaging. So the how do you out message outlandish information? I see some people rolling their eyes in the audience. I don't know if I necessarily have the solution to this. This is of course we can talk data, we can talk statistics, one of the things that I think we can go back to our earlier question on environment. If we're trying to find an environmental cause of autism, for example, why are we targeting vaccines, right? Why aren't we targeting particulate matter that's going into our water? Why aren't we fighting for clean water? Why aren't we fighting for cleaner food? Why aren't we fighting for cleaner environment? I mean, you know, this is such a weird space that we're in, and where we can target something that is beneficial to society as the cause for something. But yet, if I make the claim that I want cleaner water, and I want cleaner air, and I want healthier food for the populace, that's unattainable. Okay, so I think that's where we transition to. If you want to make the claim that autism is caused by your environment or something you're putting into your body, then okay, let's make that claim. Let's clean up our environment. How about that?
Thank you, Mr. Davidson. All right, Mr. Meyer, same question.
So I've been talking a lot about, I believe that we need a constitutional amendment. And I do believe that, but I also recognize that that is a very long road to hoe. And if you look at what I have written down, it covers universal right and scope of care, cost guarantees, finance mandate, provider choice, workforce development, accountability mechanisms, enforcement and review, and implementation timeline. And that, almost none of it has to be in the Constitution. I believe it's necessary because it's the only way to keep crazy people out in the long run from sabotaging or undermining our systems. But almost everything in there can be broken out and submitted as laws to be acted upon immediately. And that's one of the things that we need to do. We need to put laws in place. Excuse me. And what I was advocating is that there need to be annual metrics that are submitted by our healthcare system so we can all see whether we're trending in the right direction or wrong direction. And if we're trending in the wrong direction, states' attorneys general should be allowed to sue the federal government saying that they are not doing their job. I don't want this to get into a tort reform thing where we've got this lady's upset, so she's going to try to get $20 million out of the federal government. I think the state's attorneys general would be the right people to challenge that. But right now we have 30 people in charge of very important systems, and we've got to get them out, and we've got to, and one of the ways we can do that is show the harm that they're causing, and it needs to be public. And right now, the federal government is taking information away from us so we can't see the harm they're doing. They're doing it in education, they're doing it in health, they're doing it in safety. So I believe that we need to take concrete steps, that we get tripwires that tell us how things are going and be able to take action against it. Thank you.
Thank you. Thank you, Mr. Meyer. Please hold applause until the end. Eric, Dr. Peck.
Could you repeat the question? It's about vaccines.
Of course. Misinformation has become a major threat to public health, specifically widely debunked claims linking vaccines to autism, often amplified by high-profile figures, directly undermining efforts to achieve community immunity. If elected, how would you leverage your position in Congress to effectively combat and counter dangerous health misinformation?
Thank you. About 2 or 3 months ago, a businessman and an environmental lawyer stood up in front of the world and told people that Tylenol caused autism. It does not. I can promise you that. And I know that because I've learned how to read scientific study. And I know from those studies that the way it works is that if it's raining, your umbrella didn't cause the rain. The Tylenol didn't cause the autism. When you look at the studies, there's no evidence for that. And I need to make that clear as a doctor to patient. How do we roll that back? We need the vote, and we need a new administration. We need a new Congress who will support science. The NIH has lost its ability to give grants in 1,000 different ways, and we need to restore that. There have been panels of vaccine experts that have been removed from the CDC that we need back. The infrastructure for making sure that people get vax has been dissolved. The first step, and this is something that Congress can do, is oversee the executive branch. Stop giving the executive branch the ability to do anything it wants, and make sure that that executive branch upholds science. Thank you.
Thank you, Dr. Peck. All right, Mr. Taylor, would you like the question repeated?
I think this is pretty simple. We just have to make sure that everybody that's appointed to a position in government or a cabinet position is just competent and qualified. That's it.
All right, we just finished our first round of questioning. Does anyone need a water or anything? All right, let's keep going. The 9th district is largely rural, and Indiana faces significant risk of rural hospital closures and service reductions, particularly for high need services like OB and chemotherapy. St. Elizabeth and Lawrenceburg is one of the many birthing centers that have closed. If elected, what specific federal legislative action would you champion beyond general funding to stabilize struggling rural hospitals in District 9 and combat maternity deserts for expecting mothers? And we'll start with Davidson.
Right. So, Aaron missed the beautiful drive-in this morning. I'm from Washington County, same county that she's from, and our Salem Hospital, which is the closest hospital, and is at risk of closure. So I don't think anyone quite understands the detrimental effect of not having a hospital would have, not only for the patient who's dealing with a medical emergency, but also for attracting businesses and providing a quality of life for the people of Washington County. So first and foremost, we have to enhance the limited funding that they put into the big, beautiful bill to ensure that rural hospitals don't close. But also, let's talk about, you want to talk about autism, right? You want to talk about Indiana is statistically one of the worst states for neonatal care, for prenatal care, and for the outcomes of mother. So we have to, on day one, that's what I'm going to fight for. My family is the most important thing to me. We have to invest in the next generation of Americans, and we don't just invest in them. We invest in their education. We invest in their food. We invest in their health care. We have to invest in mothers and children.
Thank you, Mr. Davidson. Mr. Meyer?
So this is, I tend to talk in numbers, and I tend to think in facts. I'm an engineer, and I just can't help myself, as I've been saying, also, I believe strongly in paper. But really, these issues are about humans, and it's the life and death and suffering of all of us. And I keep going back to universal nonprofit healthcare. If you look at Canada, which I think is the largest nation in the world by landmass, they have a lot of distributed population, and they have better outcomes than we do. If you look at Australia, that has, I think there's fewer people that live in Australia than live in one single town or city in China, and they have a huge continent, and it's very dispersed, and they have also found a way to take care of the rural poor. The reason that hospitals are shutting down is that they are not financially viable. And why, in the name of Sam Hill, is financial viability the issue that that makes or breaks a hospital instead of care. There are people that need the care, and we need a system that supports those hospitals so that they don't die. They're dying dramatically earlier, like 6 to 10 years earlier than people in other countries. The rural poor need a lot of help, and this for-profit system, again, is not profiting us.
Thank you, Mr. Meyer. Dr. Peck?
We don't have a healthcare system. We have a system of abandonment. There are 3 hospitals in Indiana 9, in our district, that will close once the Medicaid cuts that are just voted in the Big Beautiful Bill are implemented. Those hospitals include Harrison Hospital, Salem, and North Vernon. I've been to North Vernon in their emergency department and shadowed to see what was going on. What was so surprising there, besides not being able to deliver a baby in that hospital, was they don't even have security in that hospital. They had to cut the security to save money in it. Harrison Hospital just rolled back its OB program and you can't give birth there. We talked about St. Eve's where you can't give birth there. This is an epidemic that's occurred. And in order to get back our ability to give OB care, we need OBs to stay here in Indiana. And when you look at IU's graduation rate, when these doctors become OBGYNs, where do they go? They used to, at about 70%, stay here in the state. Now, at about 30%, they're staying in the state. And the other 70 are going to blue states where they're not going to be persecuted. One last question, one last thing. At the very, that's what we need to do in the big picture. In the immediate, we need to put up more standalone emergency departments so that those places, I can deliver a baby, put me in the rural area in a cost model that doesn't cost as much for today until we can insure everybody and open these hospitals back up. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
I propose legislation, the Rural Mobile Health Access Act, that actually puts clinics in places where hospitals are closed. It's funded with existing dollars and has qualified staff on hand. Dr. Tim could go there, deliver babies in one of the rural mobile clinics. That's the legislation I propose. Okay.
Thank you, Mr. Taylor. All right. Injury-related deaths are 40% higher in rural communities than in urban communities. In our rural areas, ambulances take too long to arrive, which in some cases can be limited for death. Have you thought about ways to address this issue? Starting with Davidson.
Right. That is a hard question because of the geographic location, but we do a really good job in rural areas of rural firefighters, right? So we have volunteer firefighter departments. So it is feasible that we could also have ambulances that can be at the point of an emergency and provide a timely delivery to the hospital so that someone doesn't perish or their condition doesn't worsen by the time they get to the hospital. I know that in Washington County, there was some talk recently that there may not even be a third shift EMS because of also there's an issue with retracting viable talent to stay on. So we have to improve access to educational opportunities so that people go into that field by increasing the starting wage. But this is a huge problem. A lot of people in my community work outside. We have loggers, and it's a problem that has to be solved. But it isn't something that I've specifically looked at as and can provide you a solution today, but it is something that needs to be solved.
Thank you, Mr. Davidson. Mr. Meyer?
So I had not heard that number 40% before, but it's not really surprising. Farm jobs are significantly more dangerous than people realize. And one of the reasons is they're working around big machinery and a lot of equipment, and they are usually working alone or in isolation, so there isn't a buddy to help them find exit. There is a lot of problems with that. I liked the idea of his about more mobile clinics, and they did that in Western Indiana, and then the Republicans came in, and then they gutted that program. There's a problem, but there are solutions to these problems, and they are undercut on a regular basis because of money and because of political ideology. One of the things that could help, we're talking about doctors training, and EMTs, medical training should be free. It's extremely expensive to become a doctor and even a physician assistant. We need to have a significantly larger base of people so that we can get staffing into those areas. But most of it is going to be EMT help. And it's a difficult problem. I don't have a crisp answer, but more staff would help and more clinics. Thank you.
Thank you, Mr. Meyer.
Rachel, would you mind repeating the question?
Yeah, of course.
Thank you.
Interrelated deaths are 40% higher in rural communities than in urban communities. In our rural areas, ambulances can take too long to arrive, which in some cases could mean life or death. Have you thought about ways to address this issue?
Yes, I've thought a lot about this. So the other day, it's Halloween. My wife is the president of our beautification committee in our tiny town, and we throw the trunk or treat, and a child fell from a high distance and high height and hit his head. And 911 was called, and they said, "We don't have an ambulance for you." And so the family knew I was there. People ran and got me. I went to the patient, and they looked at me and said, "What do we do?" And I said, "Get in your car and drive." And they had to drive 40 minutes to get to the nearest hospital. Every EMS, firstly, should have a doctor on their shoulder through telemedicine. That's something that can happen. So that when a first responder shows up, whether it's EMS or a police officer or a fire person, they all can have the aid of a physician. Secondly, EMS workers, not many people know this, but for the most part are contractors. And because of that, they don't even get healthcare themselves. People giving you healthcare don't get healthcare. It happens for home care as well. Home care attendants who are giving you healthcare don't get healthcare. That should be illegal. That is taking advantage of working people. If we change that, we'll make the professions that much more desirable, and we'll have more people to help all of us. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
Yeah, I think we're gonna have to beat that rural mobile health clinic and beat that horse a little bit. You put care close to the people, less people die. That's just it. Thank you.
Thank you, Mr. Taylor. Sorry, I keep wanting to call you by your first name. Indiana's rural areas face acute shortages of mental and behavioral health professionals and are still grappling with the opioid and substance use crisis. In a district with significant behavioral health provider shortages, how would you use your position in Congress to specifically increase mental health care in southeastern Indiana? Starting with Davidson.
Right. So the micro answer to this question is provide more opportunities for mental health. The macro issue is the fact that poor rural people in America are poor in everything. So it's not just mental health, it's all opportunity. And that's why I've decided to run with my slogan is revive the American dream. And it can't just be reviving the American dream for the people in the suburbs and the urban areas. It's got to be providing an opportunity economy and investing in our rural communities again. And the opioid crisis, if you want to talk anecdotes, I have a lot of family members that have suffered from that. I have personally been affected by family members that have suffered from that. And it all comes down to opportunity. It comes down to economics, and it's a choice that we have made as a society to allow so many people not to have the opportunity to get ahead. So mental health and opiates, they're all related to the fact that some people feel like they don't have an opportunity to advance themselves. So we have to invest in these communities, and we can't ignore them. And we have to provide opportunities.
Thank you, Mr. Davidson. Mr. Meyer?
So you're talking about rural, repeat the question if you would.
Yeah, of course. Indiana's rural area faces acute shortages of mental and behavioral health professionals and are still grappling with opioid and substance use crisis. In a district with significant behavioral health provider shortages, how would you use your position in Congress to specifically increase mental health care in southeastern Indiana?
So there are two problems, and they're separable. One of them is how we handle addiction and mental health issues in this country as a whole. And then the overlay on that is the logistics of how do you address that in rural areas. And the fact is, if we start by looking at just generally how do we handle it, it's really, really poor. And there's a lot of ideology behind this that people with mental illness are looked down upon, and they don't. And I mean this way, but people view it as like they don't deserve care. We shouldn't, as a society, be paying for this care, which is completely wrong because they need it. And there are times we all suffer and need help. And I think the complete lack of compassion for mental illness and the haughtiness of the attitude toward people with drug addictions is just appalling. And then the separable problem, which is the logistics in rural areas, it's the same problem that we've had in others. And again, it's just killing me, but I have to agree with Dr. Peck that telemedicine is important. I have to agree with Mr. Taylor that these clinics are important. We need real solutions, and it's going to take some money. And the reason that we have not been able to get it done in the past is, number one, is it's not profitable. So in a for-profit system, you're allowed to suffer and die. And number two, ideology, because we feel that people, to paraphrase it, lazy, crazy, and homeless don't deserve our health care. How can you look at that and say another human being doesn't deserve the care that they need? It is just unconscionable. And we have to break this mindset, and we have to get those people out of office. Thank you.
Thank you, Mr. Meyer. Dr. Peck?
We haven't called on Aaron Houchin yet to say anything, but this one I really wish we did. We know what she would say on most things, but what you might not know is that she was one of only 39 Congress people to vote against refunding the opioid crisis response in the country. That includes the things that we need, and we need to invest in more, which include rehab centers, telemedicine, treating people for withdrawal in the emergency department, Narcan in our communities and around any public space, including right here in this park, in case someone overdoses. That's an easy way to fund and make sure that people have more care. In terms of mental health crisis and shortage, it also comes to what is the root causes of our drug problems, of our mental health issues. And a lot of this comes down to having roof over your head, having food in your belly. These things are crises in our country. We can build more housing. We can make sure people have SNAP. We can make sure people's needs are addressed, which will allow us to take people out of the cold, inside, and be able to treat them. A lot of our mental health crisis is because people don't have the resources to keep a home. And I see them in the emergency department every night. We need to address all of people's needs, all of people's rights, including the right to health care.
Thank you, Dr. Peck. Mr. Floyd?
Opioid addiction and mental health issues, they're all just health issues. And they should be covered like any other health issue. You shouldn't have to fight with your insurance company to go see a shrink or to get addiction recovery assistance. I think telehealth in that case would be very beneficial for a lot of people. And yeah, pretty much it.
Thank you, Mr. Taylor. All right, emergency room overcrowding and long wait times have become a major concern across southeastern Indiana. With many facilities reporting long wait times and high rates of patients leaving without being seen. While staffing is a core issue, some physicians argue that simply adding more support staff, such as nurse practitioners or physician assistants, will not solve the problem if state regulations require a supervising physician to personally sign off on every patient's chart, effectively creating a new bottleneck. To reduce wait times, what specific federal policy would you prioritize? And starting with Davidson.
So I am of the rural poor here. I spent most of my life that way. And as I said in the beginning, when I had to miss school when I was a kid, I missed a lot of school as a kid. And it got to the point where the principal said, to my mom, hey, he's missing too much school and he doesn't have a doctor's note. So my mom would take me to the emergency room. A lot of Americans use the emergency room as their primary care provider. So first we have to provide access so that that's not an option, that people don't feel like they have to go to the emergency room to get routine medical care or if they have an issue. So we have to invest in clinics. We have to invest in telehealth. We have to give people the right to health care. I think if we do those things, then the use rate of emergency rooms goes down. So I think the real issue at hand is here, and the real solution is the same solution that I said and most of us have said at the beginning.
Thank you, Mr. Davidson. Mr. Meyer?
So up until this point, I've been pretty happy with him going first because it gives me time to think about my answer before I have to actually speak. But unfortunately, he stole a little bit of my thunder this time, so I'm not feeling quite as good about it. People using the ER as their primary health is a serious problem. And that's why the clinics and the telehealth and all the other things that we've all been talking about, sometimes only agreed about, it is necessary. So if you reduce the amount of people that are using it as their primary health, that's going to help dramatically. And the policies that I'm advocating for, I think will do that. The other one is if everyone is covered, then they can go when they're not feeling well instead of when it's a really serious problem. Dr. Stone is around here somewhere. He's over in the corner. He tells a story, and since I got the mic, I'm going to steal his story about a guy that came in and he had a problem, I think, with his ankle. And Dr. Stone said, well, we need to get an x-ray. He's like, oh, man, I can't afford that. And it was obvious that it was a break, that if he had gone in and gotten care immediately, it would have been okay. But it had been allowed to fester, and it had gone so long that there was additional damage. And now it's a much bigger problem, and it's a surgery. See, I was paying attention to Dr. Stone. And there's a lot of that as well. if we can get people primary health care that they don't have to wait, it'll reduce some of the load in the ER. If we can get them so that they can go to another place instead of the ER, that would also help. More doctors, more physicians assistants, more nurses, more support staff. Maybe it wouldn't help in one site, but it would help if there were more sites. Again, we need to have more sites. And with all the hospitals closing down, more people are going to be funneled into fewer resources. So it's a resource problem, and we need to reverse it. Thank you.
Thank you, Mr. Meyer. Dr. Peck?
I've been called a number of times around telemedicine. So agree with me on telemedicine. I'd like to tell my story around that. So in about 2011, before telemedicine was a thing, I invented a telemedicine company and practice that treated patients in nursing homes. We literally had to make the technology from scratch. And in order to learn everything I could about nursing homes, and I was particularly interested in nursing homes because 19% of the patients that come by ambulance to an emergency department originate from a nursing home. And so I went and I actually lived in a nursing home for 3 months. And if you don't believe me, there's a CNBC article out there about it. And what I learned there was that people didn't need to go to the emergency department. Doctors needed to come to them. And so we created this telemedicine system. And by doing this, we scaled it largely across the country. And we actually saved Medicare $100 million doing it, treating and overseeing the care of 5,000 people a day. And so that's what brought me to DC. I went to DC and I started working on legislation and helping others work on their telemedicine legislation, and 5 bills were passed. And it's why hundreds of millions of people were able to use telemedicine during the pandemic. I'm extremely proud of the work that we did to get there. And it's really what led me to be on the stage and have the experience to do it. There's more legislation out there to expand this and be able to decrease overcrowding by getting to people at the moments of their emergency, getting to people before they get sick through telemedicine. It's already written. I wrote some of it. And when we open the government again and you elect Democrats to Congress, we will work on making that a reality. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
I think you've all said basically the same thing. Make sure everybody has coverage, move the care closer to the people, and make sure that they're covered sooner, that people actually see the doctors they need when they need to see them, and there will be no more emergency room visits for non-emergencies.
Thank you. All right. What would you propose to handle the lack of funding for VA services? Starting with Davidson.
I kind of like simple solutions. I'm not sure about you. I think we fund them. We empower them. We talk about chronic homelessness. We have a problem with veterans who are homeless. We have a problem with access too. Here's another issue when we talk about rural hospitals, right? I can't think of a better way to improve access in rural areas than to invest with veteran clinics, right? I know a lot of veterans in Washington County. The nearest facility for that, especially for emergency treatment, is an hour away. And I'm sorry, but the VA does a very good job. And I think we're starting to see this. This is what I say to people all the time about Donald Trump and our current political discourse. I think that ultimately we're going to see that government does provide a better product. And sometimes you see that when someone tries to take it away. and the VA does a really good job, and I think we just empower it. But I also think that it can be part of the solution from a federal standpoint on how we improve healthcare access in rural areas.
Thank you, Mr. Davidson. Mr. Meyer?
So right now, the VA is, I think, doing a better job than it has. And it goes through cycles. It's doing much better, and then it's doing bad, and then there's a congressional investigation, and then it does better, and then it goes up and down and up and down. And it goes up and down because there are two pressures. There's one force that's saying we need to take care of our veterans, which I agree. There's another force saying we need to sink any nonprofit government organized healthcare program, and we need to save money. And they strip as much out, and they hamstring it until the point that it's ineffective. And when people start dying and suffering again, then there's a big stink, and it gets better for a while. But it gets better, and then it decays, and it gets better, and it decays. And the reason is there is no constitutional right to healthcare. We keep saying that it's a right, but it's not legally a right. It's not a right we have, and we have not enshrined it in our Constitution. If we're going to get these people who are just trying to squeeze money out of the system, out of our healthcare, it's probably going to have to be a constitutional amendment in the long run. In the short run, we can put laws in place that force better visibility and better tripwires, but frankly, the VA and all of our healthcare systems are susceptible to these forces that are trying to destroy anything that is not for profit. And they spend millions and billions of dollars to buy Congress so that they don't have to compete with a system that works better. It is all about the politics. It's not about the care.
Thank you, Mr. Meyer. Dr. Peck?
Are there veterans and active service members here? Blythe. And thank you for serving. My father was a Vietnam veteran, is a Vietnam veteran. And when I was growing up, he actually founded and created the first homeless shelter for veterans in the United States. He did this for the Salvation Army. I grew up around a lot of homeless veterans, saw a lot of people not getting the care they need. This has been an extremely important part of my life as a child, all the way to adulthood. And I've worked in VAs as a medical student, as a resident as well. One of the things that happens with the VA is that a lot of physicians outside of the VA system don't take their insurance, won't take those patients in. And the reason for that is that the VA doesn't pay them enough, and so they say it's not worth it. It doesn't cost much in the scope of 20% of our of our budget in America going to healthcare. It doesn't cost much in the scope of how much money we spend in the government to make sure that they are paying a fair rate to physicians and providers outside the VA system. Because the VA system can't provide every single test that they need, every single physician they need. And when they're full, veterans should be able to use the community immediately. So funding directly to the VA to make their payments on par with at least Medicaid, if not what Medicare does, is the solution. Thank you.
Thank you, Dr. Peck. Mr. Taylor? Of course. What would you propose to handle the lack of funding for VA services?
Simple. I just give them more money. I mean, the VA needs to be funded. We have a great population of veterans. We have a lot of military bases in the area. VA funding is clearly inadequate, and we should put more effort into funding it properly. Thanks.
Thank you. Members of Congress get special, cheaper health care than most people in our district. Do you think members of Congress should have to buy their insurance from the same marketplace as their constituents without extra taxpayer money? So they share the same challenges as the people they represent. Starting with Davidson.
I might say something controversial here, and actually I don't. I think that it's a position that we should send our best and our brightest to do, and we should incentivize it as such. They should be able to have health care just like I think every American should have affordable health care. So I'm not going to carve out for just the politicians, but I will say if you want to solve that problem, if you want to elect people that have the same struggles that modern Americans do, then you start by electing people that have lived those struggles. And that's sort of why I'm running for Congress. We need people that are working class Americans in Congress. We need young people that see the future and are struggling and wondering, are we going to live as good as our parents did, right? So if you want to solve that problem, we solve that as the voter. We solve that through electing people that relate to us.
Thank you, Mr. Davidson. Mr. Meyer.
So there's a saying in Positions for a National Health Program, which again, I'm a member, everybody in, nobody out. So no, I don't think that they should be put into the same system. I think we should all be moved into that better system, every mother loving one of us. So and that's one of the problems that we have is that when Congress people vote on health care, they've got us broken up into little groups so that they can shaft or cut this group over here because they're not going to vote for me anyway, or I've got donors that need this special thing. But if every person in the United States was under one system, then they wouldn't be able to pit our interests against other people's interests, and they would have to live in that system. So if they say, I don't think that the mental health should be covered, and then their spouse or their child or somebody they love has problems, then they'll begin to see the hurt that they're causing. Right now, they have a special system, and they are not exposed to the same pain and suffering as the rest of us. And they also segment us. Again, there's a separate system for the prison system, there's a separate system for veterans, there's a separate system for people that are active duty, and so on. And the Native American has a separate system as well. And they squeeze it down until it causes suffering. And they can squeeze the veterans a little bit. They can squeeze the Indian system a lot more because it's not as visible and nobody hears it. But if everybody was in the exact same system, they would hear it much sooner and much louder.
Thank you, Mr. Meyer. Dr. Peck?
I'm going to answer this question a little bit differently. Basically, you're talking about, do Congress people deserve a good benefits package? Do they deserve the ability to get health care straight from the government and us pay for it? And that's part of what they get for their benefits, but they also get the ability to do inside trading. They also get the ability to stay in Congress for as long as they can continue to get reelected. They also get the ability to work with corporate lobbyists for when they are no longer elected, they can work a large paying job. Benefits package for Congress includes making sure there's healthcare reform, making sure there's finance reform, making sure insider trading is illegal, make sure term limits are in place, and make sure corporate lobbying never happens again. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
Absolutely, Congress should have to get on the same page with the rest of the population. The rest of the population should have coverage, but the Congress people should be on the exact same page. Thank you.
Thank you, Mr. Taylor. All right, we have reached the final segment of this important debate. The passion and detailed policy proposals presented today underscore just how vital healthcare is to the voters of Congressional District 9. Now, each of our 4 candidates will have one final opportunity to address you directly. They will each give a 2-minute closing statement on why they believe they are the best choice to represent you in Congress and lead the change on healthcare reform. We will once again proceed in alphabetical order by last name, starting with Davidson.
Yeah, I wanna start this last part by saying that I think that everyone on this stage, and I think you would agree, would be a better candidate than the current one we have in office. What the people in the ninth district, the people in the ninth district, and the Democratic Party, we all have to make a choice on who we think best relates to the ninth district and the problems and struggles that people in the ninth district are having. And I wouldn't be running for Congress if I didn't think that I relate to them. Just my backstory and what I went through and where I come from. These people are my people. The people of the ninth district, every single one of them. I don't care if I disagree with them. I can sit down and I can have a conversation with them, and we can leave not hating each other. I love the ninth district. I'm a proud Hoosier, and it's beyond time for us to have a public option and solve the healthcare crisis.
Thank you, Mr. Davidson. Mr. Meyer?
So I got into this race because when I was looking at when Trump came to power and started setting aside constitutional norms, I knew something had to be done. So I quit my job so I could run for office. But one of the reasons that I quit my job and ran for office is when I looked at the last race, which we lost 2-1. Dr. Peck had publicly and privately said that he's not in favor of universal health care. After I started running and I started campaigning on this issue, he privately said to people that he's looking to sound more like he's for it. I am, as I've said before, a member of Physicians for National Healthcare Program because I believe in a single-payer government-run system. I believe that you cannot have a for-profit system coexist because they have proven that they will steal the land under our feet if we allow them. And you know, I've also heard that this is a nonpartisan thing, and unfortunately, that's kind of true because Democrats and Republicans have allowed this to continue. But we have Democrats have done a lot to put the Affordable Care Act in. And I am, I think, different than maybe the other candidates because I believe we need to be fighting for a bigger picture. We have to stop small ideas lead to small votes. And we need to start advocating for something much better and much stronger than what we've had in the past. And medicine is nonpartisan, but this problem is very partisan. And it's not the Democrats that are taking these things away from us. It's the Republican Party, and we need to be honest about that. Thank you.
Thank you, Mr. Meyer. Dr. Peck?
Here in southern Indiana, our days start early for many of us. Before the sun rises, work has already begun. If it's begun in barns, in kitchens, in classrooms, in factories where people who still believe in showing up, we don't wait for help to come from somewhere else. We take care of each other. We take care of each other because that's what neighbors do. When a family's hurting, a meal appears at their door. Around here, in this community, that is not charity. It is community. But the truth is, it's getting harder and harder to keep doing what we've always done. As we've talked about, hospitals are closing. Bills keep rising. Too many families are one illness away from losing everything they've worked for. And the folks in Washington, they talk, but they don't listen, and they are literally doing nothing right now. We deserve better than that. Hoosiers deserve better than that. We deserve leaders who know what it means to miss a night's sleep, to put others first, to fight for fairness, whether it's in a hospital room, a classroom, or a field. Because the strength of all of you, all of us, and of the state isn't found in the marble halls of Washington, D.C. It's found in your hands, the hands of working people, in the nurses, the teachers, the farmers, the small business owners, the students. The world is changing fast, but values that built this place still hold. Work hard, tell the truth, look out for one another. I am Tim Peck, and I'm running for U.S. Congress, and I have something to say. Join me in the work worth doing, in the work of rebuilding trust, in the work of restoring democracy and decency, and proving that all of us as neighbors can still shape a better tomorrow together. Thank you so much for this opportunity, and I appreciate the moderator. Thank you.
Mr. Taylor?
Here's my promise. I will not ask you for one more dollar in taxes to fund another layer for your office. We'll move care closer to the people, cut the waste, and publish receipts. Mobile clinics in underserved towns. Seniors finally get their teeth, eyes, ears, and meds covered without a maze of copays. Medicaid pays for real care, not middleman margins. And every dollar is tracked on a public dashboard. If an insurer or PBM wants your premium, they compete under clear benchmarks and public audits. If a hospital's price is double the district norm, it's on the record. If ER visits drop because we funded primary care, that shows up on the dashboard. And we reinvest the savings in the frontline teams, not overhead. I'm running to make healthcare predictable, local, and fair, not someday, now. The bill's written, the math adds up, the oversight's built in. And you don't have to trust a politician's word. You can open the Congress app tonight, read the bills, see the numbers, and cast your support or opposition. This is not left or right. It's mainstream taking back control. Thank you.
Thank you to all the candidates for participating and everyone here today on this chilly autumn morning. And everyone watching at home, have a great day, everyone.
Hey, everybody, we still have more back here in the kitchen, so please help yourselves to some more if you're still hungry. We're going to keep the kitchen open until 2:30. We do have apple cider back there. It's nice and toasty if you're feeling chilly. And thank you all so much for coming out today. You all deserve a round of applause. Thank you. Thank you for speaking.
All right, there we are. I'm going to go ahead and bring myself in. Hey, hopefully y'all can hear me all right. All right, y'all. Good afternoon. My name's Scott Aaron Rogers. I am broadcasting here live from Batesville. That was our healthcare debate here in the 9th Congressional District featuring Brad Meyer, Dr. Tim Peck, Logan Davidson, and then the independent Floyd Taylor. Jim Graham was supposed to be here, but was not.
So if you've got any personal requests, feel free to come up and talk to our DJ up here, Mr. Brian Bonilla. And just keep it clean, you guys. We Democrats and CLO rowdy, so keep it clean.
That was our, excuse me, our host of the event, Victoria Martz, the Ripley County Democratic Party chair. This is an event co-hosted by Ripley County Democrats as well as Franklin County Dems. So I'm going to try and wrangle some folks here and get their thoughts on the debate. So my first thought, until I can wrangle somebody, is very, cordial, collegial debate. A whole lot of agreement and until the very end there. I think in Mr. Meyer's closing statement, when he addressed Dr. Peck directly. It was the only time we sort of got anything resembling a direct line of attack. Got some folks out here in the crowd I hope to get us an opportunity to speak with today. Blythe Potter was one of our featured speakers. I hope we got good audio for her. Things were a little rough there at the beginning, but hopefully we can get her to come sit next to us and have some words. Hunter Collins is out there in the crowd running for State House. We've also got Michelle Higgs, a State House candidate, out there. Gonna see if we can't wrangle her. Some of my favorite people out there in the comments. Actually, and I'm interested for those of you who are watching, who are still with us, didn't tune out after debate. What did all you think? Where are our Brad Myers stands? Where are our Tim Peck stands? Where are our Logan Davidson stands? And do we have any Floyd Taylor stands? We'd be interested to hear from them. And also for those of you out there in the crowd, do please help me if you can hear me. I am sitting right by the speakers here, so if you can't hear me, I understand. I might try and set up and move elsewhere. I'm sort of tied to power right now where we're at. So, in the crowd there, thank you, Renee. I appreciate your help there, helping me out with the sound. Love to see your face. Unfortunately, can't be with you in person like we were down in Salem a few weeks ago. That was a fun time live on location. So seek the beast on YouTube. Seems to like Brad Meyer a whole lot. Certainly, Brad definitely is positioning himself in the progressive lane in this race. He is unapologetically Medicare for all. Dr. Peck, less so. Sounds more like improve the system we have. Be more incentivize the private interests to perform well. In my opinion, it sort of seemed like Davidson was running the middle of those two lanes with maybe 1 foot in either, advocating for a public option, sort of in between a Medicare for all and a private insurer model. So that's kind of my read on things right now. And gonna see if we can't bring our good friend Blythe Potter here into the chat.
Hello. Hi. With my mic.
Listen, I don't know if everybody was able to catch your remarks. We were having some audio problems.
Oh no!
Top of the show. So, if the folks missed Blythe Potter, maybe recap what you had to say.
Okay, I can do that. So most importantly, the only way we change our healthcare outcomes is by voting. And obviously it's my opinion that we need to vote in progressive, left-leaning, forward-thinking candidates like myself. And voter turnout in Indiana is 50 out of 51. So how we change that is start paying attention now to candidates. Start paying attention to what their start paying attention to what their platforms are, and listen to what they've said historically about healthcare as well. I know personally, I haven't been able to keep a women's doctor around for more than a year over the last 5 years, and I think largely it's because of Roe versus Wade and just the environment Indiana has for a lack of healthcare support and the expense of healthcare. We dealt with Medicaid and Medicare issues with my father-in-law when he was dying this year, and it's just, we shouldn't have to deal with that. And like Brad was saying, there shouldn't be a separate veterans and police. Like, you're a human rights should include healthcare.
one of the things I talk about here all the time is the way you divide things, right? You divide, oh, the veterans here, the African Americans here, women's services here, whatever, military. Every order you draw is an opportunity for some goon to charge it full.
Yeah.
Essentially.
Yeah.
And the more of those artificial borders we can tear down, it's like going to Walmart or Costco, right? You can buy more service in bulk. You have better purchasing power in bulk. And the purchaser is all of us together, we have more opportunity to drive down the cost. And you need some listen, get ready for Secretary of State. It's not exactly a healthcare related position. Is there any intersection between the Secretary of State's duties and healthcare in the state of Indiana?
No, but being a candidate and an elected official, I'm going to use this as an opportunity to extend my voice even further than I've done before. Because I am very good at, am I allowed to cuss on here? I'm very good at being a pain in the ass. So, as the Secretary of State, I will be a pain in the ass as necessary to our state legislature and even our federal representatives to make sure that we have what we need. Human rights are nonpartisan. They're not negotiable. If we were to tax the millionaires and billionaires appropriately, we would all be spending about $2,000 a year on healthcare instead of about $10,000 or more a year. It's insane.
You're a veteran. Did anything that you heard as they addressed veterans' healthcare issues today stand out to you?
It did. Well, when Brad mentioned how they segment things out, but they even segment out active duty military from reserves and National Guard. And it's changed a little bit since I got home, but I had 90 days when I go home from Iraq to find my own insurance. Totally cut off. Even though I just went to Iraq, right? And I now, as a veteran, cannot get veteran health care benefits because I'm only 70% disabled and not 100%. And it doesn't extend to my family. So it's just constantly like we're being choked to death by healthcare costs in our politicians, who all of them have healthcare provided by us.
Right. Very sorry. I think they spoke to that. That was one of the questions was, should Congress be forced into this, should they be forced to buy the same health care as the rest of us? And I think, some of the candidates were like, well, yeah, obviously. And others were like, no, we should have theirs.
Everyone should have the same access to health care. I don't care what your status is, your age, your history. Healthcare is a human right, as is fresh air, clean water, food, shelter, education. I mean, we're the only developed country who can't manage to figure it the fuck out, and that's because of lobbyists and large corporations and millionaires and billionaires.
It would be comical if it weren't so tragic.
Yeah, I mean, it's like, it's just logical. Like, just treat everyone the same, and we'll all have better health outcomes and life outcomes and quality of life.
Yeah, well, listen, you've got your hands full.
Yeah, I had a visitor today. But what a great day for this!
It is.
I mean,
day here in Batesville.
We could not have had better weather.
And we're at lovely Liberty Park there in Batesville, and I spy a playground, and I bet the kiddo would love to go climb around on it.
That's what she's been doing for the last 2 hours, and now she's wanting me to take her home to nap. She's actually asking for a nap. So we did something good today.
You wore the kid out if they are asking for a nap themselves.
Thank you for being here. Thanks for having
Thank
me.
you, Blythe. The lovely Blythe for Indiana Secretary of State in 2026.
And my number one supporter. Well, 1 and 2 probably. I don't know. You might be my number one. Thank you. We appreciate you.
All right. Well, we're going to see who else we can't get in here in what passes for the spin room these days. In these things. So let me see if you can get somebody to send it my way. I'd love to have it. Thank you. Blythe doing the Lord's work there. Not only doing her own job out here as a speaker, helping me out, sitting in the big chair, and wrangling guests for me. Let me tell you. She is a real one, and I try to play things straight around here, but you all know where I stand. I'm a big fan of Blythe for Secretary of State next year. So, back to the healthcare debate here today, and like I said, it was very cordial until the very end. There, we got a little spice there at the end. Oh, what is this? We got Hunter Collins in the spin room.
Hey, how's it going?
Good, Hunter, go ahead. Get running.
All righty,
Get
here
running
we go.
there with me.
Awesome.
All right. This is my first opportunity to meet Hunter here today. So, listen, just introduce the folks to yourself, first of all, and then we'll talk a little bit about the debate here for today.
All right, sounds good. My name is Hunter Collins. I am running for Indiana House District 68. That's Dearborn, Ohio, and Switzerland County, right near Cincinnati, Ohio. We are running on a boldly progressive platform that is advocating for affordable housing, healthcare for all, fully funding our public education system with universal pre-K. So that's a little bit about me.
Very good. So, what are your thoughts on the debate here today? Did you like any of the candidates in particular who had a strong debate in your opinion?
Yeah, I thought it was a phenomenal debate. Really, everyone did a great job. The things that stood out to me the most were Brad Meyer calling for a truly universal healthcare plan. And, I thought Logan Davidson also brought some good points up that we're paying more for healthcare than anywhere else in the world. And we're getting worse outcomes. We're already paying for it, so we need to have that kind of universal coverage.
Absolutely. What about specifically your district is quite rural?
Yes.
The candidates talk about rural health care. What jumped out to you there?
Well, I was actually I was happy to hear that someone brought to attention that St. Elizabeth Birthing Center in Lawrenceburg, which is in my district, had closed down because of funding cuts. So, that's the kind of issues that we're having in these rural districts is we're having our hospitals close, our quality of care decline because there's a lack of funding. Specifically, the cuts to Medicare and Medicaid have absolutely wreaked detrimental effects on our community.
What about the ambulance service? Now, that's not something I typically thought about.
Yeah.
One thing that did not come up in the 9th District, Indiana, a question about ambulance services. The name Jamie Noel did not come up once. Was that a missed opportunity to tie the incumbent, Miss Ouchin, to one of her mentors?
Yeah, I think that is something that we need to hold Ouchin's feet to the fire. We need to take every opportunity that we have to call her out on the things that she's doing, on her mentorship, on everything like that. When it comes to the ambulance services, one thing is that in our district, the town of Dillsboro has had a essentially defunct EMS department for 2 years now. It is sometimes taking them 30 to 40 minutes to get a response for an EMS ambulance when the department is 2 blocks down the street. It is absolutely horrific. They're calling from towns 2 towns over just to get ambulance service. So that is something we have got to expand upon and get coverage for in rural districts.
What else jumped out to you today here, Hunter? It feels like we've got a strong crop regardless of who comes out of this race. Listen, I got Holly Payton here, off screen. She's joined it. Let's get Holly in to say hi. Say hi to the folks, Holly Payton.
Good to see you. I'm sorry.
We were talking about we have a good crop. Where a lot of races, I think we struggle to even get one person to run in a race.
Yeah.
Here we've got 3 Democrats plus one that couldn't be here, plus an independent in this race. a bounty of candidates in Indiana 9.
Yeah,
What inspiring, hey?
it really is, and it has a cascading effect down the ballot. When folks see that they have choices, they feel more inspired to run. And so we're getting to a point in the 9th district where I think almost all of our state Senate seats are being contested by Democrats now, which is super exciting. And we need to get to that point with our state house candidates as well. So I'm proud to be running for the state house to be a part of that.
Yeah. Are you the only one in your race currently, or do you have a primary opponent?
I do not have a primary opponent at this time. If one does appear, I will be more than happy to go toe-to-toe on policy. And at the end of the day, like you said, we have a great crop of candidates for the 9th. With any primary position, I think what we have to do is we have to, no matter what, whoever wins the primary, we need to rally behind them. Because the Republicans that are in office are doing such immense damage to our state and our country. Even if our preferred candidate, all the candidates up there were great today. But
100.
Whoever wins the primary, we've got to rally behind them. We've got to give them support. We've got to win these races.
Absolutely. Listen, I'm a primary guy. I love a good primary. I think they're healthy. I think they're important. It is important to have these discussions out loud and in public. And I welcome that process. It is what is best about democracy. So you'll love to see it. So listen, Hunter, good guy. Somebody primary him though. It gives me content. I want something to do. No, very good, Hunter.
Yes.
Thanks for
Thank you
joining
so
me
much
here.
for having me.
Listen, let's get you on the show. For real, we'll get you a whole interview one of these
Absolutely.
days.
Sounds
All right,
great.
awesome.
Thank
Hunter
you, guys.
Collins for District 68. Very good. Well, I'm going to slide back over here, see if we can't wrangle somebody else. I know Michelle Higgs came sliding by, and then she disappeared on me, so we're going to get her in here. What else? What else are you folks listening there? Terry Lightning on YouTube says, iron sharpens iron, and I agree. And if you can't handle a primary, it's because you might not be iron, you might be lead. Soft. And we don't want any of that. So, I'm going to try and wrangle some folks. Oh, hey, there's District 9 Democratic Party Chair Adam Dickey in the room. Maybe we can get him over here, too. Everybody's trying to hang out by the fire. It's kind of a chilly day here today. A gorgeous day in Batesville if you're in the sun, but we are under this lovely shelter here in Liberty Park, which provides lovely shade, but it's also a little chilly here today. I had to go grab the scarf. Little shout out to the Portland Thorns of the National Women's Soccer League here. My lovely family who lives on the West Coast got that for me, so that's it. Going to see if we can't get Michelle Higgs in here. And actually, I'm gonna give Michelle my seat, put her closer to the microphone, so my big old yap can make up the difference.
There we go.
Michelle, welcome.
Thank you.
Michelle Higgs, Indiana Rural Summit candidate for House District 60.
60. Yeah.
Say hi to the good folk.
Hi, everybody. Hi.
So, listen, what are your thoughts on the debate here today?
I actually love debates like this because it gives me a chance to hear each of the candidates kind of in their view, but side by side. So you really do get a sense of who they are more, and also just, I think, a little bit more authentic. It pushes them to be more authentically themselves than just a standard stump speech. So yeah.
Now, at this point, I know you can't. You probably don't want to pick a lane. But did any one particular candidate jump out to you as having a particularly good debate?
I I would say that one definitely did. I felt like a couple of them very much, they knew who they were. They were able to really explain why they were on this stage and what their visions were. I think there were some that were more emotionally charged in what they were wanting, and some were more pragmatic or very much, I've got this big vision and this is how I'm going to get there. And for me, I actually appreciate that. I want that long-term vision. We talk a lot about how the centrist or the incrementalism gets so frustrating. And I was actually thinking about that the other day. Why does that bother me so much? Again, around healthcare. And I think part of it is because you have a long vision, you create that incrementalism to get there, but then for whatever reason, people think they're done. So like when ACA came, they thought they were done. And instead, what we've done is set up everything so that now the insurance companies are just extracting from that. And then they're basically saying, well, that's what we have. And heaven forbid, we're still trying to get to that North Star of universal health care. And I think, I don't know, I appreciate any candidates that are like, they keep a look at that North Star and then figure out what can we do both the federal and at the state level to move things. And again, as a state candidate, I am constantly learning what are things that if we can flip the state and act like Virginia did, what are the things that we want to be able to start implementing that can make a difference on people getting health care here and now, people getting their food stamps here and now. And then beyond that, actually changing the trajectory of Indiana instead of it being a state that can only seemingly attract these mega corporations that want tax abatements so that they have an extractive economy to what does it look like to give hope and opportunity to small businesses? Man, remember when there were town squares? Remember that? Yeah. Like, what was your favorite memory as a child of going to either a mall or a small town strip mall or a town square? Like, what was something that you look forward to?
Well, no, I'll tell you what. It's funny because I'm from Michigan City, Indiana, and at one point we actually closed our downtown, our town square area to vehicles, and all of our commerce went to the south side of town where the mall was, and it actually the mall pulled all of the things away from the town square. So really, I was excited for the taste of Michigan City every summer. It was downtown in Franklin Square where it was closed. It was the only reason to go down there anymore. Yeah. And it was kind of sad, but also that was the thing to look forward to. How about you?
When I was very young, I lived in very rural South Texas, and it was a small town. My memory of it was one drugstore that the pharmacist there, his favorite ice cream was cherry vanilla. And he'd get the little ice cream bars, but he'd always have this 5-gallon drum of cherry vanilla ice cream. And I would go there after school just to get a scoop of that. And you can't find that ice cream anymore. I've yet to see it yet. But it's a weird thing that my memory is of this pharmacist who was the sweetest old guy. And just, I don't know. It's like there's something about that very local business. And I think then as you're talking about the malls coming in, I do remember that, like, oh, the malls are coming in and they're changing the makeup of our community. And they did. But then as, you know, teenagers, it was like, that's where we hung out, was at the mall, right? And now that's not a memory my kids are going to have. They don't have that memory because the malls are kind of like, and most of the stores, we don't have toy stores anymore.
No. Well, I mean, you could see the evolution of the way that commerce has just, like, you know, taken everything they can out of our communities and then tosses us to the side because, you know, they'll take your downtown, close all those businesses, put them in the mall. Well, now I was just back up in my hometown a couple weeks ago for a wedding. The mall was closed now.
Yeah.
So that's gone. Walmart and then Amazon, killed the mall.
Yeah.
And ironically, the new business growth is back in the old downtown area.
Yeah. Yep. And as a matter of fact, in my district, Martinsville, they're having a resurgence of the town square. They now have a theater that's coming in, and they're renovating the whole square. And it's like, it's hitting that critical mass. So we talk about that. You have to hit critical mass. But it is a community investment and effort. The thing that grieves me, though, is I'm seeing that happening in Martinsville, for example, but in my other same district, the town of Monrovia is getting a data center, and their local businesses are like, wait a second, no, that's not what we want. And so that's the thing that I'm kind of going, I don't know that people will be growing up in the same kinds of communities with the types of businesses that they're wanting to bring in.
I mean, in a way, that's just, that's progress, right? We're always growing up in a kind of different environment than we grew up in. And, there's the parts that we want to hold on to and make sure we keep. And then there's parts that, aren't great and we want to improve upon. And sort of, that's always sort of, this dynamic, this debate that we're having, ongoing.
But it's like, but yeah, I'd love to see, I would love to see more investment in the quality of life. I think that's it. The quality of life is, I think we look so much at the consumeristic side of it, or we look at the ease of people. They go to work, they come home, they sleep, that kind of, there hasn't been a real sense of community for a while.
The third space.
That third space, right.
Yeah.
And then also I think with COVID, it just unplugged everybody, and that was so disorienting. The good news is we are now in a place where everybody, I think, is comfortable being on a Zoom call. So we've never had the same degree of connection while at the same degree of disconnection. It is a weird paradox.
It really is. Like, well, I mean, that was the big promise of social media, was that it was supposed to bring us together, right? And really all it's done is made us further apart. We've never been more divided, even though, we're two steps from just about anybody in the world. I want to roll this thing back to the debate here and talk. You are specifically a rural organizer, operating in rural communities. What about the rural angle of today's debate? They were where they specifically talk about ideas for rural healthcare, in terms of like ambulance access, rural clinics, hospital closures. What stood out to you there?
I think it really is what stood out the most was that we first have to recognize the harm that's happening, but more importantly, the harm that has happened over the last 20, 30, 40 years. So we didn't get here overnight. We didn't get to a disinvestment in rural, or what I would say actually when we did, how long ago was it now we did the motorcade for Medicaid?
That's been a few months.
So when we were doing the motorcade for Medicaid, specifically driving through parts of rural Indiana, just to experience what it's like to, we would go visit a hospital and be like, well, what if that hospital wasn't here? What if we had to go to the next hospital? And that drive. And what I really noticed was more that Indiana isn't a vast, sprawling rural area as much as it is the shuttered towns. Yeah. And that is heartbreaking, because to me that just shows that a forgottenness. And all I can say is somebody who has grown up in rural spaces and oftentimes feels like the opportunities, the invitations to participate aren't necessarily offered in the same way. You don't show up in your community expecting to have a voice or that your ideas are going to matter. And the more I talk with people, like, they have vision and they have ideas for where they live, and they also know where the problems are. And that's the big thing is if they know where the problems are, but they keep trying to talk to their legislators and the legislators don't listen, you know, what are we doing? So I don't know. I think though what came out to me in the debate was they really just highlighted so much of an awareness of the problems for rural. Again, if you close an OBGYN, then how far does a pregnant, mother need to travel in order to deliver a baby? And we've heard of more and more people in their cars and stuff right? So guess what? That probably puts more liability onto our ambulance drivers, right? Suddenly. And I don't know. It's that connectivity. We live in an individualistic world. And what we're seeing is actually that is the lie. The lie is that we're very connected. We're very dependent on each other one way or another. And you can't start to cut services and things at these hospitals and expect it not to impact you.
Yeah. Listen, I hate to come off like a huge commie, but I talk about this all the time. Is that the capitalism does not serve rural communities well, precisely because of the inefficiency. We're spread out. We're not concentrated in one place. And, capitalism depends on efficiency. It depends on, concentration, population density. And, as a business, you know where the customers are. And in rural spaces, the customers just aren't, So it's ironic that out here in rural Indiana, we are most capitalist. We are most anti-communist in a way. And the voting against your interest thing is a trope. And it's it's dishonest, but there is a kernel of truth there.
Yeah. And I think that I don't know. There's a part of me that goes back to at the very local level, you have community farms, you have gardens and people producing, whether it be vegetables or even meat. Like I'm able, if I wanted to find somebody who is selling, a quarter of a cow or chickens or whatever. And that is available in rural that I don't think in urban you have here as easily. But we lack, I think, some of the, I think where regulations and stuff have kicked in is they have hobbled the ability of rural to think and act for themselves because they forced a dependence onto a system. And so that's the part where at every turn, it just seems like, government's coming in, maybe heavy-handed, saying we need to do this, this, and this. But again, if you don't have the actual stakeholders from those communities coming in going, that's not maybe the best thing here, we're going to lose out. And that's what I feel is happening.
So, well, I guess before I let you go to take care of what you got to take care of here to do, what are your kind of closing thoughts here for today, for the debate, for everything in general? What do you want our viewers to take away from today?
I think with this debate, we have candidates that do have a vision for how they want to represent Indiana. And I think it speaks well that first off, they show up. Okay. I can't say that for Karen Houchin in these spaces. But also, again, just looking at what is the role of an elected official and especially in Congress where I feel like we talk about the three branches of government and they're supposed to push and pull and keep each other in balance. And we have an executive branch that is demanding of every branch of government and into the state. And so unless we elect other people who are not beholden to that executive branch, we're not in for a good thing. That's for sure.
Very good.
Thank
Well,
you.
Michelle, I appreciate you taking the time to join me here today.
Thank you.
Thank you as always.
All
Good
right.
to see you. One of my favorite people in the world there, and probably the best damn organizer in Indiana, Michelle Higgs, for House District 60 and the Indiana Rural Summit there. So I'm going to go ahead and see if I can't wrangle one more person here. Maybe get someone to talk, take us up to the 3-hour mark today. So we have a nice round number at the end of this thing. I wonder if I can't. Hey, there's another Potter. We got Michael Potter there for House District 47 hanging out. There's our guy. Would love to see if I can't wrangle one of the candidates here. You know, I don't want to leave my perch here. But if I can't flag down one of the candidates and get them in here, we're going to see if I can do that. Oh, well, I'll be damned. I'll be damned if that's not one of my guests for tomorrow. Well, there's Ross Thomas. He will be with me on Who's Left this week tomorrow morning at 10:30 a.m. right here on this very channel. Looking forward to hearing Ross's thoughts on the election this week. I think we're going to spend most of our time talking about that for sure. You know, what kind of lessons we can learn for Indiana.
Absolutely. What a great topic, right?
Yeah. There. I'll get Ross in here. We're gonna slide up next to each other here. There you go. So, preview for tomorrow. What are your big takeaways from the elections this week? Pick one race that really stood out to you, and I got to tie it to Indiana.
Well, so I think I would look at the New Jersey governor's race, which was polling close.
Yes.
And what it shows, which is the most important thing, turnout. The reason that it polled close and it wasn't close is because the race is modeled on a particular turnout model.
Yes.
And the Democrats blew that model out of the water. So when you poll a small group of people and then you extrapolate from that based on what you think the turnout's going to be. Well, the Democrats came out in force. And when Democrats come out and vote overwhelmingly, that's why that wasn't a 3-point race. That was a 15-point race, and it wasn't even close. So it tells me in Indiana, for Democrats to win, you look at Barack Obama in 2008. Barack Obama wins here because of massive turnout of Democrats. And that's what we need. We don't need 54% turnout in Marion County ever again. We need 75% turnout in Marion County for statewide races. And we need massive turnout. And we also, look, something we don't have a lot of control over, but we also need Republicans to be disillusioned and depressed.
Do you think here in a few weeks, beginning of December, State House, we got this special session gonna go into effect? You know, they're gonna talk about redistricting. I mean, first of all, I think the Republicans might be having some regrets, some second thoughts about doing redistricting after seeing like every district in Virginia flip this week, and that might bite them in the ass if they do the redistricting.
I am of that opinion. Look, I don't know what the map would look like. I know a map that was leaked, which I don't think is a real map. But if it was, it divides Marion County into 3 districts. You ask any Democratic candidate running in the state if they would like Marion County voters in their district, they will all say yes. So in the long run, if you have 3 districts that have Marion County voters in them, you've got 3 competitive districts from jump. I can't imagine that they would do that. But then again, the people who are making those decisions don't give a damn about Indiana, and they don't give a damn about the long-term health of the Republican Party in Indiana. They just want instant gratification. and that's what they're trying to get. But I mean, in the long run, anybody who's not stupid would look at that map and say, this is bad for Republicans in the long run.
Yeah, I'll tell you, obviously it's cheating, and we don't want to see them do it. These districts are unrepresentative of Hoosiers. But you know what? After this week, I'm like, go for it. I dare you.
Yeah,
I dare you.
At the end of the day, look, we can win. Destiny Wells was famous for saying, we're not a red state, we are a purple state with a turnout problem, right? And that is absolutely true. If we can we have the lowest voter turnout in the United States. If we can turn that around and get people excited, give people a reason to vote, and get them out to vote, all of these races can be competitive. Look, you can gerrymander as much as you want, but we see that in Texas. These gerrymanders in Texas are counting on the fact that Hispanic voters are not going to turn out. But if they do, gerrymander all you want, you're still going to lose. So I say bring it, and I'm excited, and I think a lot of people are excited to really get out there, hit those doors, talk to people, let them know there's an alternative to, maybe we can have honest government. Maybe we can have, less corruption. Maybe we won't be making porn videos in the lieutenant governor's office. There's a whole lot of things that we can do.
Well, I'll tell you what, Ross, I'm excited to continue this conversation with you tomorrow.
Absolutely.
We're not going to give away the farm today, though. So,
well, good to see you. We'll see you tomorrow.
Thank you, Ross Thomas, Bartholomew County Democratic Party chair there, and we're going to see him tomorrow on Who's Left This Week, 10:30 a.m. Eastern on this here very channel. And I got one of the candidates from the debate joining me here in the spin room, which isn't really a room. Brad Meyer.
Hey,
welcome. Welcome back. Let's see. Here we go. Let's scoot in there. How'd you do? How do you think you did? How did the debate go from up there?
I think I made the points that I really wanted to make, and that is that universal health care is both needed and incompatible with the current for-profit system, which will do anything that it can to keep their business.
Very collegial debate, a lot of agreement, a lot of nodding heads, a lot of Brad Meyer talking about how much he, gave credit to Tim Peck for some of his ideas.
Yep.
Good to see. Little spicy there at the end. Yes. A little bit of a direct challenge. Listen, I like to mix it up. Maybe I'm a weirdo. I wanted to see that earlier in the debate.
Right.
What do you think? Are we going to get some more little tussling as this race goes on?
I think eventually. Well, so number one, this was not the comments that I made were not untrue, and they were not assassinating his character. I think that Tim Peck is a good guy. I'd love to have him as a neighbor, especially, in case I get sick. I've got somebody next door that can take care of me.
Yes.
But there are some fundamental differences, and I'm trying to make it very clear what the differences are. And I think he's trying to make it very unclear what the differences are. So that's where the pushback is coming from.
I definitely saw it from this angle, and I'll just stick to the Democrats for now. I'm not going to address what Mr. Taylor had to say so much, but of the three of you who were on the stage, I definitely saw like 3 lanes forming. And there, Brad Meyer is running in the Medicare for All lane.
Absolutely.
Tim Peck is running in the let's improve the private system we have lane.
Correct.
And Logan was sort of running in the public option, the Jean-Claude Van Damme, straddle both lanes at once sort of thing. Did I seem to read that correctly? Is that what you're seeing?
I'm not sure if Logan's position exactly matches what you're describing, but I'll leave him to speak to his position to clarify that. I'm not saying you're wrong. I'm just saying that
absolutely.
that he should have an opportunity to refine his position.
100%. Yeah, probably the appropriate thing for you to do to defer there. So what was there a question you wanted to hear from the moderator that you were like teed up and ready to get and you didn't get a chance to talk about?
You know, pardon me. I think that the moderator and the questions were good. I think the order and the way they handled it was good. This was a good good debate. I would have loved to have had an opportunity to really differentiate my position, but they gave us 2 minutes at the front and 2 minutes at the back, so that all worked out. So I have no complaints.
Yeah, absolutely. And then I guess the final thing I want to say you have a chance to talk about before I sign off for us here today is since you are the only candidate to join us here in the spin room,
right?
And if the folks out there heard you, liked your answers, liked your vision, where can they learn more about you and your campaign?
So you can look on bradmeyer.org, which is my website. And if you're interested in healthcare, you can go to the healthcare tab, and there is a list of documents. There's a 3-minute video, which I thought they were going to play here, and then also a multi-page draft constitutional amendment that I'm putting forward. And that constitutional amendment, as I think I mentioned in the debate, there's nothing in there that would prevent that from being implemented into law. So that I think there ought to be 2 copies made of this, and one of them we start pushing to get laws enacted to support it, and then we get a constitutional amendment put in that locks those in so that crazy people can't undo it later.
Parallel tracks, right?
Yes.
Not putting all of our eggs in one basket.
Correct.
And even if you get one of your baskets across the finish line, you don't stop.
Right. Well, and the alternative path is to say that I think it was Mark Twain said that the key to success is to put all your eggs in one basket and then watch that basket. But unfortunately, I believe that we have to try to do it legislatively, do it through the ballot box, and then also through the constitutional amendment.
And I might add through people power, through organizing, and
Yeah.
through us raising our voices. Yeah,
absolutely.
All right. Well, I'll let you go. I'm sure you got a lot of more hands to shake there, Brad. Thanks for joining me.
Thank you all, and thank you for joining.
All right. Well, I'll tell you what, we're coming up here on the 3-hour mark, and I think that's as good a place as any to go ahead and end this thing. I mean, we're only scheduled for another 15 minutes here at the facility. They're going to run me out of the joint, so I should probably start cleaning up my stuff. So, in the meantime, listen, love these guys. Great folks. Going to see more of them around here on this channel, and see more of you hopefully tomorrow. Who's Left This Week, 10:30 a.m. right here on these very channels. The website is who'sLeft.us. You can also find us on YouTube and Facebook Live, and we'll have it all out in all the places later wherever you get your podcasts. Now, until then, I'm going to go ahead and sign off. I'll see you tomorrow morning. My name is Scott Aaron Rogers. This has been Who's Left, a special presentation of the Hoosiers for Healthcare Indiana 9th District Democratic Debate. I'll see you next time. Love each other, Indiana.